Okay, our first one to go is activated charcoal. You may also see this as Actidose. Or there are very, very common names for it as well. Outside of this, all of them have activated charcoal. You may see some with added medication called sorbitol as well, and they may come with a little packet of cherry flavoring that is supposed to make it a little more palatable to the person. I have yet to see anybody palate it very well. With that said, going on, this is an absorbent. Is its class and its action, well, kind of self-explanatory. Absorbs toxins, poisons within the GI tract or the gastrointestinal. So this is taken orally, or it can be put through a NG tube or an OG tube if necessary. Some people just cannot palate it, and it we'll get into a little bit more, but can cause vomiting as well, which creates more problems for us. So our indications would be most orally consumed poisons, and medication overdoses. Okay, that can be used after the evacuation of poisons. So what that means is, in some cases you may see where a stomach is pumped, or they do a gastric lavage, and they stick tubes down the esophagus into the stomach, flush out the stomach contents, suction them out, and then create, to get out what's there. They'll look for pill fragments or any other indications that there may still be some of the medication or toxins or poisons within the stomach contents, and then they may give the activated charcoal then again after that to absorb, go through the GI tract and try to absorb anything else that they can possibly get that's already entered into the digestive system. Contraindications would be to comatose patients. Obviously, you're not going to want to give this to anybody that cannot protect their own airway, even if it's being given through NG or OG tube. If they do vomit without a secured airway, there's no way to protect that. You do not want to give it after the ingestions of corrosives, or caustics. Running out of ink. Petroleum distillates. Those would be gasoline, diesel, kerosene, anything that's distilled from petroleum products or distilled from oil. You do not want to give this with other oral medications, and you want to use with caution. Actually, it says use with caution. However, I would probably avoid it. Any patient that is experiencing abdominal pain or anything like that as well, with that you don't know what's going on, or a known GI obstruction. So, known bowel obstruction. Sorry. Unknown abdominal pain. Adverse effects, if it's aspirated, can cause a fatal pneumonia. Aspiration pneumonia. It can cause constipation, black stools, diarrhea and vomiting. And bowel obstructions. Those would all be considered bad things. It comes in a bottle or a tube with directions on the side of it. It can come in a black powder that you mix as well in some instances. It is a suspension, so with that, obviously, the powder, the charcoal is suspended within the solute. Usually comes at 25 grams to 125, 200 to 50 in the bottles. I guess it did not put that up there, so. Lost my blue pen. First video of the day, so I'm just getting into it. 25 grams of charcoal and 125 milliliters of fluid, or 50 grams and 250 milliliters bottles or tubes. May come with flavor. Okay, so again, like I said, it's not very tasty. Most people I've seen within 5 minutes of administration like to vomit. Effects start immediately. Peak effect depends on gastric function. If your stomach is, or if your digestion is slow, or if it's whatever, it's going to take longer, and it will act until it is excreted out of the body. So the longer it stays in the system, the more it absorbs. Of course, that doesn't come without its problems. It's constipation, bowel obstruction. Quite literally, it's eating a charcoal briquette or drinking a charcoal briquette. There are no real drug interactions with this. Mainly watch for your contraindications, your comatose, ingestion of caustics, corrosives, or petroleum distillates, as well as your known bowel obstruction and unknown abdominal pain. Use caution or just don't give it in those instances. It's often used in conjunction with mag citrate, which is a quite powerful anti-constipation med, laxative. Must be stored in a closed container. Be sure to mix it well, absolutely. Shake it. Shake it a lot. It settles and likes to reform into a charcoal briquette in the bottom of the bottles. If you are going to give this to somebody for maximum effect, make sure you shake it. I would turn it upside down. Shake it, beat it against the palm of your hand, squeeze the bottle as much as you can, break it up as best you can. It does not, however, absorb cyanide, lithium, iron, lead, or arsenic.